Hello, it's Senator Ben Cardin. Welcome to Facebook Live, an opportunity that I take advantage of every so often to update the people of Maryland on timely subjects that we're dealing with in the United States Senate or in our nation. And for today, I want to update on the current status of COVID-19 vaccinations and where we are with COVID-19. I think we all are very encouraged to see a return to a more normal type of environment. I can tell you that's certainly true with the traffic I see in the morning commuting to Washington. There's a lot more cars that are on the road. I know that we see restaurants, people eating indoors. We see a lot more people without masks. There's more gatherings than we've seen. So we see that our country is returning to a much more traditional existence. I've had a chance to travel, and I know the same thing is true, not only here in the United States, but around the world. But at the same time, we have a dangerous increase in a very contagious variant of the COVID-19 virus, the Delta virus. And that we are very concerned that as the seasons change and we get into cooler weather, that could very well cause a spike in the number of COVID cases. So today on Facebook Live, we're going to go over the current status of the vaccination program and the virus in our community, and where we think we need to put our attentions and our priorities and what we all can do to get beyond this pandemic. I have two experts in this subject that are going to help us sort this all out. Dr. Michelle Gourdine, who's the Chief Medical Officer and Senior Vice President, Population Health and Primary Care at the University of Maryland Medical System, and Dr. Maria Maguire, Health Officer from Talbot County Health Department on our Eastern Shore. So, Dr. Gourdine, let me first start with you, if I might. Just update us as to where you think we are in the current status of people being vaccinated and trying to get this pandemic under control.
First of all, Senator, let me just thank you for inviting me to join you today. I really appreciate all the efforts that you and your team have made to provide this opportunity for education and information, which is so important in our sort of wrangling this virus and this pandemic to the ground. So where we are, I'd like to start with the state of Maryland, because I think that we're really doing quite well in the state of Maryland in terms of fighting this pandemic. The vaccine that we've talked a lot about really is our clear pathway out of this pandemic. And some of the things that you led with in terms of seeing people out more, I certainly relate to what you said about traffic. It is becoming heavier now as people are getting out and about. And those are really good signs that we are moving in the right direction. I think the most recent statistics relative to Marylanders who are vaccinated, about 58% are fully vaccinated. More than 70% have had at least one dose, and that's terrific news, and we want to continue that progress. So where we are in this state, we are in a good position, but our work's not done yet. We need to continue to make sure that these vaccines are accessible and that we're able to ensure that people receive the information they need so that people who are not yet vaccinated are able to get vaccinated as quickly as possible. That's how we fight the pandemic. That's how we prevent from more serious variants like Delta from appearing.
Dr. Maguire, I believe the numbers in Talbot County are not quite as high as the numbers that Dr. Gourdine mentioned, but I understand Talbot County is one of the strongest counties on the Eastern Shore as far as their vaccination rates are concerned. So give us an update on the challenges that we have in our more rural communities.
Yeah, that's exactly right. And again, thank you so much for inviting me on. It's a privilege and honor to speak with you and Dr. Gourdine today about this really important topic. And you're exactly right. Dr. Gourdine's right too. We're doing very well comparatively to other states in Maryland. And I can add that of the eligible population in Maryland, it's up to 74% of individuals 12 and older have gotten at least one dose of a vaccine. So that's really excellent news. But you're exactly right to point out that the progress is not uniform across locations throughout Maryland or even across the country. And especially some of the more rural jurisdictions have been seeing some difficulties getting people vaccinated. In Talbot County, we have been lucky for a number of reasons through both hard work and sort of demographic luck. A lot of our population was very eager and eligible early on. And that allowed us to really vaccinate a huge proportion of our population very early when the messaging was such that we were focusing on the seniors and healthcare. 29% of our population here in Talbot County is over the age of 65, and that meant quite a lot of people were eligible. You compare that with other counties, and the average for Maryland, the seniors make up about 18% of the population. And so we kind of got a head start in a way and lucked out that way. But we've also had to really adjust our strategy, as have all the other counties in Maryland, as the pandemic has evolved. And whereas early on we had lines of and lists of people on wait lists, and the supply was low. Now we're in the opposite situation where we have really the supply is not a problem, and we're having to really target very smaller numbers of people who are not yet vaccinated and who are less eager or have more obstacles in their path.
I think we all remember those days in, I guess, December and January and February, where people were trying to find where they could get an appointment for a vaccination. They're saying, well, why don't you hurry over to this county or that county? And people were shopping all around in order to get vaccinated. That there were much greater demand than there was any supplies. Now we're at the point where we're closing down the mass vaccination centers because you just don't have the demand for the mass vaccination centers. So the circumstances have changed pretty dramatically. But we've also been able to extend eligibility by age. So we're now at age 12 and older. I think the younger people are getting the Pfizer vaccination. I think that's the one that is preferred. For those that are beyond those age limits, I guess 18, you can get either the Moderna or the Pfizer or the Johnson & Johnson, which is a one-shot vaccine. So the supplies are there. We want people over the age of 12 or older to be vaccinated. I think that information is pretty well understood by the public. So what's the reluctancy here? Why don't we have 100% vaccination of those over the age of 12?
Well, and what we're seeing actually is the highest percent of vaccination is in the older age groups. And, there's this very clear, crescendo across the ages of the 20 to 29-year-olds are much lower, have much lower rates of vaccination, and the 12 to 17-year-olds have even lower rates of vaccination. And that is even more divergent across counties in Maryland. Some counties, such as Howard and Montgomery, have in the 60% of their 12 to 17-year-olds vaccinated, whereas other counties have in the teens. And I think in some ways the messaging early on, has affected people's sense of risk benefit with getting the vaccine. So early on, we kept talking about how we were focusing on seniors and people who are very high risk at complications and being hospitalized. And unfortunately, I think it meant that some people assumed that the younger people and children were, not at risk of COVID or its complications. And what we're seeing, especially now with the Delta variant, is that's becoming less and less true, and that variant is even more transmissible than the other variants we had seen so far, such as the UK variant. And it's important to note that, we really won't achieve herd immunity without these younger age groups getting vaccinated. So, right now in Maryland, about 25% of our population is under the age of 18, and that's a huge amount of people who need to get vaccinated to really confer protection on themselves and others. And then, of course, with the school year starting in the fall, last year, a lot of students simply were not at risk simply because they were doing virtual learning, or they just weren't in person with a lot of people. You know, in our county, on a given day, maybe a third of students were in a classroom at a time. But it's going to be a totally different situation this fall, when we really hope to get pretty much all students in the classroom 5 days a week. But at the same time, we're probably going to have fewer protective measures in the community. And so that's why we really want to push to get teenagers vaccinated and the younger people vaccinated too.
Dr.
Yeah.
Gourdine, this is a challenge because we all socialize, but the younger population are more aggressive in the method in which they socialize. If you go to a bar, you're more likely to see younger people at the bar. If you go to the social events, again, the younger people are more likely to be out, certainly later than the older people. As pointed out by Dr. Maguire, with school starting in the fall, it's a younger population that we're going to see in close proximities to each other. We have now this Delta variant. It's just coming into our community. I think the last count I saw that as of, I think the early part of July, we had a little less than 100 confirmed cases in Maryland of the Delta variant, but it is extremely contagious. And we are being told by experts it will be the dominant form of the COVID-19 virus in a pretty short period of time. So what can we do to get younger people vaccinated? It's absolutely essential if we're going to be able to prevent a widespread spread of this disease.
Senator, I think we need to be very clear in our messaging here. Dr. Maguire pointed out something really important, which was that during the first few surges of COVID, there was the thought that younger people would not be seriously impacted by COVID-19. We now know that that is not true. We are seeing instances of younger and younger people now being hospitalized with COVID. Unfortunately, some dying with COVID. There was a recent report from my home state of Mississippi where there were 10 children on life support in Mississippi due to COVID. So we need to be very clear. COVID is a serious disease that affects young people as well as older people. That's first of all. Secondly, we need to be really clear about some of the information and share sources of reliable information about COVID that people can access, including through social media. There is a lot of great information that's being shared and education about COVID through social media, but quite frankly, there is some misinformation that is being spread about social media as well. And we have to do our part to counteract that information and provide people with the information that they need to be able to make the decision to get vaccinated. One of the things that I often share with people is, we talked about the risks and benefits of getting vaccinated, and we have to do our research and understand these vaccines. These vaccines are safe. Millions and millions of individuals in this country and beyond have received these vaccines and have been protected against COVID disease. And at the end of the day, the way I looked at it, what I advised to my family members, my children, was I would rather take my chances with the COVID vaccine than getting the COVID disease. We've got to be really, really clear about this deadly disease and the fact that we are not yet out of the woods. Although we are doing relatively well in Maryland, there are other states in the South and in the Midwest that are still struggling with rising COVID numbers. There were reports out of Missouri that they were running out of ventilators for individuals with COVID, that their numbers are higher than those that were seen during the most previous COVID surge. And finally, a lot of this is driven, to your point, by the Delta variant. Probably 3 months ago, the variant was responsible for less than 1% of cases across the country. Now we are looking at more than 50% of COVID cases in the United States being driven by the Delta variant. the way you prevent new and more virulent variants from emerging is for enough people to get vaccinated that the virus is no longer easily spread from person to person. We are not there yet. We would encourage everyone to get vaccinated. And let me just say one more thing about the communication piece, Senator, if I could. I think that we did a great job in providing information. We're continuing to do that across the country. All stakeholders from healthcare, trusted leaders in the community, faith leaders, elected officials really have joined together in a concerted effort to provide information about the vaccine. And that is in large part what has driven the large majority of individuals who have been vaccinated. Now we are down to the last individuals who we need to be able to provide information to. And that's going to require, in some cases, one-on-one, one-on-two conversations with people, talks with their doctors, talks with people who are community health workers, for example. We cannot give up on providing that one-to-one guidance and feedback and being willing to answer people's questions. There are no dumb questions when it comes to this, and getting people comfortable with the vaccine.
So I want to drill down a little bit more on the risk factors of the vaccine versus not having the vaccine, because I have run into that issue with some individuals who are not vaccinated. And I think we need to really drill down on this so the facts are understood. I think we all look at the warnings that are on all of our prescription drugs, and if we read them very carefully, we might be reluctant ever to take a medicine again in our lifetime. And yet we know that our prescription drugs are keeping us alive, literally. They're allowing us to control heart disease. They're allowing us to deal with diabetes. They're allowing us to live a much more normal life than we ever had before because of the miracle of prescription drugs. We know that our vaccines have been extremely effective in stopping the dread of polio, of dealing with the annual flu shots. All those issues have kept us all healthier and given us a much longer life. And yet there are some adverse consequences to every one of the issues I've just talked about. There are cases where people have had reactions. Some of the reactions are really minor. Some of them are more serious. So we require that individuals know about the risk factors before taking any medicines, because we want to make sure we have complete transparency. But we have a very rigid process for evaluating the safety of all medicines under the FDA. So no drug gets into the market unless its benefit far outweighs the risk factors. On COVID-19 and the vaccines for COVID-19, it's my understanding that we're not even close as far as the comparison between the risk factors versus the benefits. And Dr. Gourdine, you mentioned that in your answer, but we are talking about, I don't know of anyone that I know of that's had a very serious reaction to a vaccine. I've had friends who have been very, very sick with COVID-19. So you don't want to get COVID-19.
That's right.
And you can, the most likely reaction you're going to get from the vaccine itself is maybe a sore arm or a little bit of tiredness or a little bit of a fever for a short period of time. So you're the doctors. Am I right?
Senator,
Yeah.
you're absolutely right. I think that, the side effects for the most part, for the majority of people, have been quite minor. So a sore arm, maybe a fever, maybe you're tired for a day or two. Some people have no side effects at all. I had absolutely none. And it varies depending on the person to person. But I want to get back to another point that you made, which is vitally important. And it was a concern relative to how quickly this vaccine came to market. One of the things that we know is that in terms of the normal FDA process for approving vaccines, it typically takes a long time. This process was quicker than most. However, I can say with certainty, no corners were cut, no steps were skipped in the approval of this vaccination. In fact, in terms of evaluating the safety of this vaccine and the efficacy, how effective it is in preventing severe COVID disease and hospitalization. All of those steps were taken. And the reason I can say that for certainty is not just because I'm a doctor, but because I'm the daughter of an 80-year-old mother who I wanted to be able to do the research and provide to her with absolute certainty my declaration that the vaccine is safe for you to get, Mom, and as soon as you're able to get it, get it. And that's exactly what I did. And I think it's important to share that with the audience.
Dr. Maguire, you want to add to that?
Yeah, I would just add that, the safety of these vaccines is so important to understand because these vaccines have been undergoing intense monitoring both before they achieve the emergency authorization and since they've been given since December. So you have to keep in mind that over 334 million doses of these COVID vaccines have been given in the US since December until this week. And that is just a huge number. And before then, the trials involved tens of thousands of individuals. And there has been constant monitoring by the CDC and FDA. And whenever there is a perceived concern, even about a vaccine, it's very important to note that the CDC and FDA have been very transparent in communicating those potential concerns. So, just this week, there was a concern that came out about Johnson & Johnson, and it found 100 cases potentially linked to that vaccine of an autoimmune syndrome called Guillain-Barré, which is it's very common, resulting from viruses and other things. But that's out of 12.8 million doses of Johnson & Johnson vaccine. And so I think it's important to note that the transparency is so critical in making sure we communicate the safety to the population. And I have to say, any concerns that we had as actual vaccinators at the local level early on, we made sure that there were medical professionals on hand when we were giving vaccines. And, we made sure that everyone who was eligible met all the criteria. And we've had absolutely no problems in the 13,000 plus vaccines that our health department has administered. And, I have to say these vaccines are being constantly monitored. I receive still my VSafe texts every once in a while from the CDC asking about my health. And then, of course, there's the VAERS website where people can, offer up any potential, side effect they're feeling. But you're absolutely right. The vast, vast majority of any side effect is very, very mild, very temporary, and that has to be put in comparison to the risk of COVID, which we know that a lot of the side effects people are worried about are much, much worse with COVID. So, blood clots, long-term consequences, the long COVID. And we don't know about what long-term COVID will look like. And so in my opinion, and the opinion of the medical community, the safety of the vaccine is much, much higher than risking COVID.
And just to underscore this for one last point, we hear very irregularly anyone who's had a reaction to the vaccine itself. But as we speak, there are many Marylanders that are in intensive care in our hospitals under COVID-19. We're losing people every day in the state of Maryland that are dying from COVID-19 every day. So this is still a very serious disease in our community, and its consequences are deadly. So this is not a close call. It really is not a close call.
Senator, can I just quickly piggyback
Sure.
on what you just said, just really quickly? In the month of June, every single COVID death in the state of Maryland was in an unvaccinated individual. I just wanted to make that point.
No, that's a very important point, and thanks for mentioning that. And as I said, we're losing people every day, and it's still a very deadly disease. It's not under control yet. It's certainly much better shape, and I really want to applaud the leadership of the Biden administration, because if you go back to January, we were among the worst countries in the world in dealing with the vaccinations and the COVID spread. Today, America is a model nation in the world, so we've made a lot of progress. We take advantage on Facebook Live to take questions, and Alexis has asked us, I was vaccinated in March, but I traveled to Georgia. Should I get a COVID test? It raises the questions of the needs for COVID tests. I don't know whether Alexis was going to the state of Georgia or the Republic of Georgia. So we'll take it both ways. Should you get tests if you're going into a community that perhaps has a higher rate of the virus than our own community? Dr. Gourdine, you want to lead us off on this discussion on testing?
Sure, sure. So, assuming she was fully vaccinated, which means she got 2 doses of the Pfizer or Moderna or 1 dose of the Johnson & Johnson. Again, the vaccine protects you from getting severe COVID disease requiring hospitalization. Having said that, it is possible after receiving the COVID vaccine to test positive for COVID-19. The great likelihood, though, is that you will not become severely ill from that. And so I'm not aware, unless Dr. Maguire is, of any specific recommendations relative to needing to get tested or mandating that if you visited a high incidence or prevalence area. But certainly, if she begins to feel symptomatic, certainly should receive a COVID test.
Dr. Maguire?
Yeah, I agree. Right now, the recommendations are that vaccinated need to get tested, if they travel to that type of area, unless they become symptomatic or they're a close contact of someone who is. And so that's another benefit of the vaccinations. And one thing that can help spread the word about, the reason to get vaccinated is that if you're right now, the recommendations are such that if you're fully vaccinated, as Dr. Gourdine explained, you do not need to quarantine after being exposed, and you do not necessarily need to get tested. And there are no more mandates, especially in the state of Maryland, to do so. And so that can actually help, because as we think about one of the reasons why some people have chosen maybe not to get vaccinated is they don't see the benefit, but actually there are some very practical benefits, which means you don't have to stay home from work, you don't have to miss school, you can continue participating in your athletic teams, for instance, and that was a huge maybe not as significant a reason in my book in terms of getting vaccinated as, conferring immunity to this deadly illness, but it confers a lot of freedom. So yeah, I agree that she doesn't necessarily, but always monitor your symptoms, because no vaccine in the world is 100% perfect all the time, and it is still possible to have a potential breakthrough infection. So monitor yourself for symptoms, and if you do notice any symptoms, then do get tested. And fortunately, testing is very accessible now too, and in many places still free. So that's the best recommendation that I can offer.
I'd like to make one additional observation. If you're traveling, make sure you take your vaccine card with you, because it's going to be required at places to make sure you're fully vaccinated. Particularly if you're traveling outside of the United States, you must have your vaccination card. In some places, they're going to make you have a test before you can enter either an establishment or a country, unless you have your vaccination card and shows that you're fully vaccinated. So it is your card that will give you entry into a lot of places that otherwise you're not going to be able to get into. Another good reason to get the vaccinations, because it does give you a lot more freedom in your travel and options as we see the United States and we see the international community starting to open. And it's going to be much more challenging in other countries to get around if you do not have a vaccination card. So another good reason. I want to first just one more time introduce our guest, Dr. Michelle Gourdine, who's the Chief Medical Officer, Senior Vice President, Population Health and Primary Care at the University of Maryland Medical System, and Dr. Maria Maguire, Health Officer, Talbot County Health Department. Our conversation today is updating you on the current status of vaccinations and COVID-19. So let me we talked about the variant, but what is a variant, and why is the Delta variant? First it was the UK variant, but now the Delta variant. Why is this different than the original virus that we saw? Can you help explain what happened here? Was this anticipated that we were going to have variants? What is a variant?
So
Doctor,
I can take a stab at that first if you like.
Sure.
So variants are basically, mutations that occur in viruses and bacteria. It's very common, and this is why often we talk about how some may be antibiotics, things are resistant to it. It's because mutations occur. And viruses are particularly good, and especially this coronavirus is particularly good at developing emerging variants. And what happens is, as time goes on and the infections spread across populations, then the virus starts having mutations that allow it to survive and spread better. And, we think of survival of the fittest back in biology. And what initially was, a very serious illness has gotten worse and worse with the variants that have spread very quickly. First we heard about the UK, or now called Alpha variant, that has a 50% or more transmissibility, meaning it's that much more contagious. And we saw the effects of that in the UK in the winter time, and how rapidly that spread and caused more severe illness. And then, of course, we remember what happened in India with now what we call the Delta variant. And so these variants are much more likely to spread much quicker than that original strain of COVID, and quite possibly be harder to treat. Some of our treatments may not work as well on these variants. And so that's why we see, now I believe in Maryland, almost 40% of our hospitalizations are people who are in the ICUs, which we weren't seeing, a year ago. So the virus will constantly evolve. And one thing that's important, we keep talking about the importance of vaccines, but as Dr. Gourdine mentioned earlier, the vaccines I kind of think of as they protect me individually, they protect my community, especially right now, the people who are not eligible to get vaccinated. But it acts as sort of an obstacle in that a variant can't spread if I'm vaccinated, so that's our one way to be offensive in this fight. The virus is constantly, mutating because it replicates constantly. And the only way we can get ahead of the virus right now is in vaccinating enough people where we won't have more emerging variants. And we're also, something like the Delta won't spread as quickly because each of us who are vaccinated will act as almost like an obstacle from it spreading further.
Dr. Gourdine, are we confident that the vaccine is effective in protecting us against the variant as it is against the original COVID-19?
I think we are confident, yes. We know that the vaccines, the currently available vaccines, Johnson & Johnson, Moderna, and Pfizer, do confer protection against the Delta variant. One of the things that's important to understand is the COVID vaccines against the, let's say, original version of COVID-19, when the vaccines were first available, were extraordinarily protective, upwards of 90% protection against severe COVID disease and hospitalization, which is really pretty much unheard of. If we think about the vaccinations that our children get, we even think about the flu vaccine, which is roughly 60% effective. So comparing the COVID vaccine to that was highly, highly effective against the original COVID-19. Now, when we look at the Delta variant, the most recent studies that I have seen show that the vaccines, the three that are currently available, are upwards of 60+% effective against the Delta variant. So the bottom line is these vaccines protect us against Delta. These vaccines, as Dr. Maguire just stated, if we get enough people vaccinated, also protect us against a worse variant, a more contagious variant than Delta from developing. So two really, really good reasons that we've got to get individuals comfortable with being vaccinated and going ahead and getting that vaccine. It's no longer an issue, Senator, as you stated earlier about there being enough supply. There's sufficient supply now. We've got to get people vaccinated so that we don't see another variant that is potentially even worse and more deadly than Delta.
Jocelyn on Facebook asks us, do I need to get a booster shot? Several people have asked me that question. Do we need booster shots? And should I just go out and get another shot now because there's no lines? What should we do? Dr. Maguire, you're a health officer. How do you answer that?
So right now, there's no recommendation to get a booster shot. There's definitely some research ongoing to determine when that might be something that is recommended. But the studies coming out about the longevity of the immunity conferred by these vaccines, every time a study comes out, it's showing that the immunity from the 3 vaccines available in the US is lasting longer and longer. And so that's very promising in that we won't need a booster, right away. It's a high probability. I believe we will. I don't think we'll need one, within a year of getting your first sequence. But, research is ongoing, and I think really our efforts should be focused more on trying to vaccinate the unvaccinated people and using our vaccines for that rather than giving anyone a booster right now. But what we've found is that immunity to after having the vaccines is actually much longer lasting than immunity from having the COVID virus itself. And, the earliest people to have received the COVID vaccines were really the people involved in the studies. And, that's only been, a year or so. And so we don't even know the potential for how long the immunity from these vaccines lasts. But those studies are ongoing. But at this point, no one needs to go out and get a booster. And when and if that time comes, we will definitely, be mounting large campaigns to do that.
Dr. Gourdine, Dr. Maguire raises an interesting question about the immunity you get if you've had COVID-19. We talk about the antibodies and that protects us. So if a person has had COVID-19, should that person get a vaccination?
Yes, absolutely. One of the things that Dr. Maguire said, I want to reiterate, which is that what we are learning now, apparently, is that the immunity that is conferred from getting a vaccine lasts longer than that from getting the disease. And I've actually heard a number of people say that the reason they're not going to get the vaccine is because they're already protected with natural immunity because they had COVID before. And that is absolutely not sufficient to protect them from getting reinfected and potentially having more serious disease. So the short answer is, if you've had COVID, you still need to get the vaccine. The natural immunity is not going to be protective enough to keep you from severe disease or death.
Well, and I think that's important. Now, we're talking about reaching those that haven't been vaccinated. The strategy for availability of the vaccine has been through mass vaccination sites, through a lot of the retail pharmaceutical companies or big stores have been the source. That seems to be changing a little bit to the individual healthcare providers' offices. So we've always had challenges in underserved communities, in minority communities that don't trust us as much. So what should we be doing to reach out to make it easier for people to get vaccinated who otherwise may fall through the cracks because they're just not going to be taking advantage of the distribution system that we currently have? Any suggestions? Talbot County, for example, there are a lot of people in Talbot County don't really live close to their healthcare provider. There's now you don't have a central location that you might have. What should we be doing?
Right. That's a very important point. So early on, as you said, the mass sites, these large campaigns to get vaccinated were successful, but right now that's not working. And what we found throughout this pandemic is that the strategy to vaccinate people has needed to constantly evolve according to the needs of the people in the community. And so right now, us as a small health department, we are trying to really target the populations, the areas, the zip codes that have lower vaccination rates. We're trying to have smaller scale vaccination events. We're going to, and I know all the other counties in Maryland are doing the same thing, going to events where people are. So we sort of changed our strategy from saying, we're here, you come to us, to we'll go to you. We went into over 200, homebound residents' homes to do vaccinations in their homes. We are working with partners in the community to mount small-scale vaccine events. For instance, recently we hosted a vaccine clinic at a Hispanic market, and we had great success with that community. And we're also working with some other community partners that target other types of demographics. And, we're still seeing in Maryland that there is still a disparity between, especially the African American community and Hispanic community compared to whites and Asians. And in Talbot County, there's a disparity of about 10 to 15% in terms of vaccination rates. And so we're very much trying to achieve vaccination in a very equitable and accessible fashion here. And that means we need to go to where the people are who need it and engage with, members of those communities, and involve trusted partners. And so the strategies for vaccination have definitely changed. And we also are, trying to listen to what the concerns of people are. And again, as Dr. Gourdine had mentioned before, is, constantly promote giving out accurate information that speaks to the person, because no one message is going to work for everybody. And so you really have to tailor your messaging to what speaks to that community or those individuals, which varies by their own lived experiences. And so I think that's where we are now, trying to really target, okay, who's not vaccinated and why, and understanding what their experience is, and then going to them and making it as easy as possible, whether that's, having weekend and nighttime hours to vaccinate, or physically going to locations where people are. We also had campaigns where we went to places of work and just vaccinated the workforce right there, so that transportation wouldn't be an issue. So there's a lot of ways we can do it. In some ways it's a little harder than what was occurring, in the early spring, but it's important, and we have to, keep mounting, these efforts as we, try to get to that more universal vaccination rate.
Dr. Gourdine, we have our problems in our urban centers as well, in reaching communities that have not traditionally been served, where there may be a little bit of mistrust in regards to those that are administering our healthcare system. Do we have a strategy in our urban centers to reach those that are not vaccinated?
We absolutely do. For example, the University of Maryland Medical System has undertaken a multi-pronged strategy to be able to address the issues that may revolve around traditional mistrust of the healthcare system, and also to be able to create spaces where people feel comfortable asking their questions. And so they're quite similar to some of the strategies that Dr. Maguire has described. For example, we have a mobile vaccination unit that goes out to our most underserved hotspot zip code areas. For example, in Baltimore, where the vaccination rate may be low. So communities in Baltimore where there's low vaccination rate are identified. We take our mobile vaccine van out to those locations. We work, again, as Dr. Maguire stated, with people that the community already trusts. They may not trust us as much because they don't know us, but certainly working in partnership with faith leaders or community leaders is extremely important. Again, as I stated earlier, sometimes it is sort of one-to-one attention that you provide to someone where you prove to them you're there for them to provide whatever information they need in order to be able to make the decision as to whether or not they want to receive the vaccine. We have our mobile integrated health teams who do similar types of activities in targeted communities as well. And then we are also working with our primary care providers. Many people trust their doctor. If my doctor is Dr. Smith, I trust what Dr. Smith tells me. And so equipping the doctor and her staff to be able to provide information to individuals and also to be able to provide the vaccine right on site is very important. We need to be able to, we believe that we need to be able to provide vaccine in those opportunities where we have the individual who is ready to get the vaccine. And so that is what we are doing, one-on-one interaction, trusted individuals, answering questions, creating a safe space to be able to create that comfort level to get vaccinated.
I know Congress provided substantial financial support for these outreach programs. They've done it on a couple of occasions, both in the previous Congress and in this Congress. Do you have adequate resources to implement this strategy, or is more needed?
So, Senator, I'll start first. The resources have been greatly appreciated, and certainly have provided us with the tools that we need to be able to tailor our strategy as we're moving along to the need. And the overarching need that we keep in mind is our ability to prevent COVID infection and to properly treat COVID infection and hopefully prevent adverse outcomes, including intensive care unit stays, prolonged hospitalizations, and death. And so we are grateful for the resources that have been provided. They have absolutely equipped us to be able to do that, while, by the way, also being able to continue to deliver health care to others who are not infected by COVID who need our services as well. So I just want to offer thanks to you and our delegation for ensuring that those resources have gotten to us and gotten to our communities.
Well, thank you on that. Dr. Maguire, let's talk. We talked about the testing. When the virus first started, we were told wear a mask, wash your hands regularly, and stay home if we're not feeling well. All right, we're now in July of 2021. Is that still good advice?
So definitely, you know, the CDC constantly updates its guidance on what people should do. And the very first thing that we've been talking about, of course, is getting vaccinated. Washing your hands, and, you know, practicing all the protective measures that the CDC has advised this past year are true for, you know, just staying safe from any infectious disease. That's partly why we saw that there was hardly any flu this past year, and another infection called RSV was barely on the radar this year. And so that's really important that people continue those measures of especially washing hands and not going out when you're sick, staying home when you're sick, so that we don't spread these illnesses to other people. You know, so at this point, the CDC recommendation is that if you're fully vaccinated, again, that's 2 weeks out from your last dose, then you do not need to wear a mask, you know, when you're out. But people who are unvaccinated really should continue to wear a mask, especially in indoor locations. And so, you know, for many people, that's the choice they've made, and they really need to follow that advice. But, you know, it's certainly appropriate if someone feels more comfortable to wear a mask. You know, for many people, they may not mount as strong an immune response because of certain things like they're on chemo or they're immunosuppressed. And so it's perfectly acceptable to wear a mask. And we should definitely learn from this experience and try to, you know, keep some of these safe habits, you know, use hand sanitizer and wash your hands. And I just want to jump back again on what Dr. Gourdine was saying about the resources. Again, we can't thank the federal government enough for all the financial support. There's no way we could have mounted anywhere near the response that we've done. And I know I speak for all the health officers in Maryland, and everyone in public health, saying, thank you for advocating for us. And I think one thing that we've kind of learned from this pandemic is that really the infrastructure and trust of public health is something that really needs to sort of be rebuilt for the future, so that whenever anything anywhere similar to this occurs again, hopefully not soon, we'll be better prepared to really act quickly. Because I think that's one thing we've seen from this experience, is that public health was, sort of chronically underfunded, understaffed, and we're used to that in a way. But I think there's a lot we can learn from this experience to be better prepared going forward.
Yeah, that's a very important point, our medical infrastructure. And yes, we did not do certain things quick enough in order to deal with COVID-19. We had institutions in place that were disbanded and not funded that were supposed to deal with a pandemic. And we did not have the secure supply chain issues, which is another very important ingredient to deal with a pandemic. We have taken steps in each of those areas to shore up. But the United States is blessed. We have incredible talent in our country, where we have incredible facilities. We have resources that other countries don't have. This pandemic is global, and we can't control it unless we can control it globally. So we can try to eliminate the virus here in the United States, but if it's in other countries, it will get to the United States. And the healthcare infrastructure in so many places in the world is so deficient. And we see that today, where the virus is still very much rampant in countries that do not have those types of healthcare facilities. So I really want to applaud President Biden for donating 500 million doses of the vaccine for the global community. It's right for us to do that from a humanitarian point of view, but it's also in our self-interest to build up the capacity of all countries. So I'm glad you mentioned that. Yes, we need to be better prepared at home, but we also have to join the international community to make sure that we are protected against any further global pandemics. All right, the challenges of the fall. Let's just get to this. It's going to get colder, and children are going to be back in school. You both have mentioned that. A lot of these children haven't been vaccinated because of age. They can't be vaccinated in some cases, in the cases if they're under 12 today. This seems like we got to be very watchful as to what happens in the fall, because we don't want to have to go through the pain of another shutdown. So what precautions should we take, recognizing that the weather will get colder, people will be indoors more, and schools, we hope, will be open with our children there. Dr. Gourdine, what can we do?
So I'm glad you brought up the fall. As optimistic as I am about and heartened as I am about the progress that we've made in this country, and we made a great deal of progress that we've outlined during this call, I'm worried about the fall. Because we have not yet gotten out of the woods yet relative to this virus. This virus has shown its propensity to mutate, to create itself into new variants that are much more transmissible. And so we need to not take our foot off the accelerator. We've talked about the importance of vaccination. We also need to continue to emphasize the points that you and Dr. Maguire just talked about relative to appropriate masking and hand washing and appropriate distancing, especially for those who are unvaccinated. Those are still cornerstones that we need to adhere to. I'm aware, my daughter's a school teacher in Howard County, and I'm aware that there are activities that are underway to ensure that our students are safe. And obviously, our students, our teachers, faculty, staff are a top priority here. And we need to do everything we can to keep everyone safe. But the point I want everybody to walk out of here with today is that we are not yet out of the woods. We have made great progress, and we are beginning to see what normal might look like. but we still have to remain vigilant throughout the fall.
Dr. Maguire?
I fully agree. And, it may feel like we're in the middle of the summer right now, but those of us in public health, we always look at what's on the horizon. And what I'm anticipating and what we're starting to see the signs of is a bit of a surge. And the question is always, how high will that be? So right now, we know in the past couple weeks that cases in the US new cases have doubled. And, so throughout the rest of the summer, it's very important that we really focus on vaccination of those who aren't, and continued protective measures of those who aren't vaccinated or are not able to be vaccinated. And again, as we expect in the fall, students to go back to college and universities, thank goodness a lot of them are requiring vaccination of their staff and students. That will help. But to get to full immunity takes some planning. So with the Pfizer vaccine, it takes about 5 weeks from start to finish. And so that's why really now is the time to make sure that anyone who's been waiting get vaccinated so that we're ready and we can avoid any problems with that are anticipated in the fall, and maybe we can really avoid a bad surge.
Well, it just brings me to the point we've been stressing all along. Get vaccinated, please, unless you have a specific medical reason and you're advised by your physician, your medical advisor not to be vaccinated, get vaccinated. It's just too much at risk. We're not out of the woods and we don't know what's going to happen in the fall. And as has been pointed out, we're not at that degree of coverage of vaccines or herd immunity where we're safe. So a breakout could occur. And we don't want to repeat what we saw last year when so many people were coming down with the virus. Our hospitals were overrun, people's lives were ruined, and people lost their life. We don't want to see that happen again. We don't want to see families where they can't send their children to school. That disrupts their entire planning for their children's education and for their ability to earn a livelihood, the family itself. We don't want to see that happen again. We don't want to see businesses that are shuttered, some that have never been able to reopen because of this pandemic. The price that we've paid has been so great in lives, in our economy, in our way of life, that we owe it to our community. We owe it to our family. We owe it to ourselves to be vaccinated. So during this warmer period of the summer, make sure you're vaccinated because it's going to take a couple months before you're fully vaccinated. And we need to make sure that we have as much protection as possible as we enter the fall season. So I just really want to make that push. I can tell you the pain, I think we all know the pain that we've gone through. We see a light at the end of the tunnel. Working together, we all can get there. Let me once again thank our two guests, not just for being on Facebook Live, but what you do every day to keep our community safe. To Dr. Michelle Gourdine, the Chief Medical Officer and Senior Vice President for Population Health and Primary Care at the University of Maryland Medical System. We love the University of Maryland Medical System. They do great work for our community. So thank you for joining us. And Dr. Maria Maguire, Health Officer for Talbot County Health Department, the frontline worker and keeping our community safe. Thank you both for all you do to keep our community safe. And to those who are with us today on Facebook Live, thank you for joining us. We'll talk to you all again soon.